In your third trimester, one thing you're definitely missing is lying down on your tummy. Oh my god. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. O. You already know. Yeah, whether I like it or not, I'm your pregnancy partner. Nobody's taking that position from me. And your husband might be the one following you to the labor room, but me, I'm following you throughout the pregnancy journey. And trust me, I love to hear when you finally have that baby, because it's our baby, it's not only your own. Okay, so let's jump right into today's topic. You know, for the past 2-3 weeks, we've been doing a pregnancy series on what to expect at each stage of pregnancy, and we're taking it in trimesters. So 2 weeks ago we did first trimester changes to expect, and then last week we did second trimester changes. So to wrap up this series, we're going to be doing third trimester changes today. So sit back, relax, and enjoy. Let me continue my gist from where I stopped last week. You know, like I told you, in the first trimester, suffering and smiling. Second trimester is party hard because you don't even remember you're pregnant. But then when you get to the third trimester, the tempo drops again because now baby is bigger, your tummy is bigger, right? And you're now starting to feel the weight of the baby, right? So one of the symptoms that you might experience in the third trimester, and a lot of women do experience this, is backache. You start to feel like your back is aching, especially when you stood for a long time. Let's say you're the one that likes cooking or something, you have been cooking, and you just stand for like 1 hour. You start to feel that back pain right there in the middle of your back, and you're like, oh my gosh, can this baby come out already? Like, third trimester, most women will say it is the longest trimester for them because it's like time is not even going. Like, you want the baby to be out, like, okay, just come out, you have stayed too long, your rent has expired, but the baby is not coming out, and time is just going and going and going, and baby is still there. There are some babies that are even so stubborn. 40 weeks is time when you come out is a lie. They're enjoying the place too much. Sometimes you even have to induce labor for the baby to be able to come out, right? But most babies, of course, by 40 weeks they're out. Some few days to 40 weeks, some a week before, 2 weeks before. So that's why your due date is plus or minus 2 weeks. So anytime from 38 weeks you can go into labor. Even for some people there is early term, so even from 37 weeks you can go into labor. But the point is, we don't like to leave baby in the womb past 42 weeks. So by the time you are nearing 42 weeks, let's say by the time you are 41 weeks plus, your doctor already started telling you, see, talk to your baby. If your baby doesn't come out, we bring the baby out. So either by hook or crook, that baby must come out. So I digressed. Now I'm back to what I was saying. Backache is one of the very common symptoms of third trimester pregnancy, right? If you are experiencing this, there are some pregnancy support belts or pregnancy support bands that you can wear to help, you know, to support with the weight of the baby, because some babies are really heavy, right? So that can also help to ease the back pain. But all in all, don't stand for too long, right? Because you feel the back pain more when you stand for too long. When you are sitting, get a comfortable sitting position. I know that when your tummy is so big, even sitting with your legs closed is a problem. So some pregnant women will be sitting like this, with legs open. And of course, by now in your third trimester, one thing you're definitely missing is lying down on your tummy. Oh my god. Then lying down on your tummy will seem like the best thing ever. You miss those days when you could just turn around and lie on your tummy like there was nothing. But now, lie on your tummy for what? You'll be suspended in the air. But don't worry, very soon the baby will be out and you'll be able to lie on your tummy anyhow. In fact, after I gave birth to my baby, I think that was the first thing I did, right? Lie down on my tummy, like, oh my god, I missed you 9 whole months, you know. So that's one of the things third trimester moms miss, right? Being able to lie down on their tummy. Another symptom that you're going to experience in third trimester, similar to what you're already experiencing in the first trimester, is heartburn, right? So that heartburn is going to come back again, or for some it has even persisted throughout, right? So when that acid from your tummy is flowing back up into your throat, and then you feel that burning sensation, uncomfortable sensation in your chest. So like I said before, if you experience that, just see your doctor and they'll prescribe something that you can take to relieve your symptoms. But don't worry, before you know, your baby will be here and all this will go away. Okay. Another symptom that you experience, like I said before when we discussed about first trimester pregnancy, is frequent urination. So toilets here, the moment you see pregnancy tests and you see 2 lines, just sign a peaceful contract with toilet, because you guys are going to be the best friends until that baby comes out. So you're going to be going to toilet a lot to pee, and it's even going to be more in the third trimester because the weight of your baby, you know, the pressure from your baby's weight, head, everything is going to be pressing down on your bladder. So your bladder is not even going to be able to expand so much to accommodate as much urine as it could before that baby grew that big, right? So you're just going to be peeing every time, right? So yeah, I wish I could tell you that you can escape this phase, but unfortunately you can't. So anytime you go out as a pregnant woman, the first thing you want to spot is the toilet. When you enter a place, look out for the toilet. Start asking, where's the toilet? Where's the toilet? Where's the toilet? If you're in your church, know where your toilet is located. If you're at work, make sure that you have your personal toilets. I'm just joking, but yeah, just make sure that toilets are available for your comfort, because you're definitely going to pee a lot. And that's why a lot of pregnant women, they normally avoid all those long journeys where there are no toilets available, you know, all those long road trips that you're not sure when next you see a toilet. If you're pregnant, especially in your first or your third trimester, just avoid it, because you'll be so uncomfortable. Another thing most women experience, or a lot of women experience in third trimester, is hemorrhoids. So hemorrhoids is when those blood vessels around your anus, right, they begin to swell, and they begin to, for some people, even become painful, right? So you just notice, like, at the entrance of your anus, around your anus, there's a bulge, and you can feel it there and it's visible, right? So that normally happens in a lot of pregnant women, especially in late third trimester, because of the pressure that is coming from the baby, right? And you might still experience constipation, just like you were doing in the first trimester, just because of those muscles that progesterone has relaxed, right? So you might still be experiencing constipation. Hemorrhoids is a complication of constipation. Just get ready, you might have hemorrhoids. Those are some of the unpleasant symptoms of pregnancy. And another one, which I mentioned last week in the second trimester, was that you can also experience Braxton Hicks contraction. So at this stage, you are closer to labor. So when you're experiencing Braxton Hicks contraction, you'll be like, oh, finally this baby is coming out. Let's say you're already 38 weeks, and then you just see that, the contraction is not even real. That can be so annoying. So like I said last week, you need to know the difference between real contractions and fake contractions, right? Because you want to know when to rush to the hospital to go and give birth to that baby that you've been waiting to see. So I have another video where I talk about the signs of labor. If you are third trimester, then you definitely should know the signs of labor. So look out for it. It's in my labor room playlist, or I'm going to link it somewhere in the description or end screen, right? Look out for it and learn the signs of labor, so that you not go to the hospital when it is too late. Once you see the sign, pack your bags and be going straight to the hospital. I also have another series where I talked about what to pack in your hospital bags. For those of you that don't know what to pack, or if you haven't started packing, if you're in your third trimester, especially you are already like 36 weeks, what are you waiting for? Start packing. See, babies don't give announcement before they come. You can be in the market shopping like this, and then you're just going to labor. So have your hospital bag packed, so that all anyone has to do is pick it and run to the hospital. No wasting time. If you haven't watched that one, to make sure that you look through my labor room playlist and watch the video. I also put a free downloadable checklist of what to pack for yourself and for your baby, so that you can print it out and use it when you're packing. Very, very important. You don't want to be in the hospital on labor day and discover that you forgot something at home. That would be so annoying. I mean, your husband is not going to find it funny having to go back home to get any item for you. So make sure you have your hospital bags packed before time. If you enjoyed watching this video so far, please don't forget to click the like button and subscribe, and share with anyone that you think might need to see this. Always remember, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.